Okay, our last topic in the respiratory system is going to be to look at some disorders and diseases. We're going to start with the concept of COPD. So, overall, COPD is a collection of diseases that are characterized by the inability to get air out of the lungs. So, the air is trapped in the lungs, but it very quickly is deoxygenated, and so even though the air is there, it's not functioning the way it should. There are two components that are the major causes of COPD. The first is emphysema. So in emphysema, you have a twofold problem. The first is the enlargement of the alveoli, which destroys the respiratory membrane. So you're losing surface area for gas exchange to occur. The second is a loss of the elasticity. So now we're basically having giant air sacs, and we've lost the ability to recoil to try to push some of that air out. People who have emphysema generally are going to need their accessory muscles for just normal quiet breathing. So we're going to see the sternocleidomastoid, the scalenes, all of these things that are going to try to help force air out. The second most common that we see in here would be chronic bronchitis. Here we have basically the formation of scar tissue due to constant inflammation driven by constant exposure to irritants. And then as the lungs become fibrous, your mucociliary escalator and things of that nature, they don't work, and we start seeing more common infections. Most people who have COPD have a little bit of both, a little bit of emphysema and a little bit of chronic bronchitis, but one tends to present more than the others. And there's kind of descriptive yet kind of funny names that go with them. People with emphysema are called pink puffers. Pink because they're not cyanotic, and puffing because they are consistently trying to force air out. They usually have pursed lips, and they're just constantly trying to breathe out. There's a lot of effort going into it. Chronic bronchitis patients are called blue bloaters because they generally present as cyanotic or blue, and it's associated with right-sided heart failure, which causes there to be a backup of fluid in the peripheral system, so they're very bloated in appearance. When you get into patho, you'll get into the differences between them. Both are related to smoking, so smoking cigarettes is still the number one risk factor for COPD. Everybody always wants to know about smoking other things. Chronic bronchitis and COPD are certainly going to be possibilities when you smoke anything. It doesn't matter what it is. If you inhale something and it makes you cough, then that's your body's way of saying, you're activating my irritant receptors. I don't want this in here. It's going to damage me, and there will likely be lung damage. Smoking cigarettes, in addition to COPD, is also going to be related to lung cancer. Is smoking things like marijuana probably not related to lung cancer because we don't have the carcinogenic properties, but certainly related to a situation with chronic bronchitis. So here we can kind of see what's going on here. There is one thing that could lead to emphysema that isn't environmental, and that is a genetic condition where you have a deficiency in what's called the alpha-1 antitrypsin. And this actually inhibits an enzyme that breaks down the elastic tissue in your lungs. And so if you don't have enough of the inhibitor, you end up breaking down the elastic tissue of your lungs, leading to emphysema. But other than that, it's really environmental and primarily smoking related. Either way, we tend to see the same overall features, and they are treated very similarly. These people hypoventilate. They are hypoxemic because they're not exchanging gases the way they should. And it's going to lead eventually to something called respiratory acidosis, where we've got so much CO2 in our body because we can't exhale properly that it drives the production of hydrogen and we become acidic. And so we've got pH issues. A couple other ones, asthma. So this is very prevalent in our society. Asthma is going to be characterized by kind of a twofold situation. There are episodes, sort of asthma attacks, if you will, of coughing, painful shortness of breath, wheezing, the spasms of the bronchi. And these attacks or episodes can be life-threatening if we don't get the airway back open. That's primarily what we thought asthma was for a very long time. More recently, we have uncovered the fact that in addition to this sort of episodic nature of asthma attacks, we have a continual, constant, daily inflammatory response that is also occurring. So treatments for asthma now include anti-inflammatory drugs that are going to help deal with the daily inflammation and rescue inhalers and bronchodilators and things like that to deal with the asthma attacks. Tuberculosis is a significant respiratory infection caused by Mycobacterium tuberculosis. There are multiple reasons that tuberculosis is so significant. We've got about a third of the world's population infected with latent tuberculosis. For the most part, they don't have the active version, but the issue is that if you have these tubercles in your lungs, at any point, it could become active again. It's highly contagious. This is the reason we have to test our healthcare workers for TB. It's the only thing we test you for, because you don't have to do anything other than breathe in order to transmit TB. So we've got a huge number of people walking around with basically ticking time bombs in their body. We've got a highly contagious disease that has now developed drug-resistant strains. And if we do have treatment available, it's not a course of, 2 weeks of antibiotics. It's at the low end 6 to 12 months, and at the high end over 2 years of treatment in order to clear it. And if you don't take the full course of treatment, in all likelihood, you will develop another strain of TB. Add on to that your body can't clear it without it. So without taking the drug therapy, your body, your immune system does not have a good defense against TB. When you put all of that together, this is a nightmare of an infection. And while we don't hear a ton about tuberculosis in our day-to-day life here, there are absolutely places in the world where TB is just ravaging populations. And usually they're very urban, they're very low socioeconomic. There is usually a overlap with the HIV positive population. And so there are places in the world that tuberculosis is of the utmost concern. Here, we want to make sure that our healthcare workers are tested routinely because, again, you're going to definitely be within 6 feet of your patients, and anyone within 6 feet of you can transmit tuberculosis to you. So for, the sake of the number of patients that you're going to see as a healthcare worker, we need to know if you have TB or not. All right, lung cancer. Lung cancer is a leading cancer causing death and doesn't get as nearly as much sort of popular content as we see on some of the other ones. A lot of times because it is related to smoking, and there is a kind of an unfortunate, well, this is your fault type of attitude that goes with it. Because we don't have good screening and We haven't put a ton of money into finding better screening. Most people who have lung cancer die within a year or two of the diagnosis, and the 5-year survival rate is only 17%. That's dismally low. So smoking is absolutely the number one thing related here. When you smoke a cigarette, not only are you exposing yourself to mutagens that are known carcinogens, you are also paralyzing the cilia and completely deactivating that mucociliary escalator, which means anything in your lungs is just going to go all the way down. So then as you continue to smoke, all of the cancer-causing agents are going into the depths of your lungs, and there's no function to get them out. There's no filter, there's nothing to move any of that mucus. And so it is significant in terms of causing lung cancer. If we detect it early, oftentimes we can remove a portion or up to an entire lung. That is definitely going to impact your respiratory volumes for sure, but you can survive with a portion of or only one lung. There's 3 common types, each that kind of has their own specific thing going on. Adenocarcinoma would be the least concerning. Squamous cell carcinoma is usually going to present with bleeding, so coughing up blood. And of them all, small cell carcinoma is the most concerning as it grows directly into the mediastinum, where we have a huge lymphatic supply and basically is able to metastasize very, very easily. So here we're looking at somebody who has both emphysema and lung cancer. Smokers often have both. So not only are you decreasing the surface area of the respiratory membrane and increasing the alveoli, you're also taking up useful space in the lungs via the cancer. Here we're looking at a lung that has multiple large tumors in it. And oftentimes these tumors will spread to the bones around them, so there'll be tumors on the rib bones and the clavicle and things like that. If you have a patient that tells you that it's too late for them to quit smoking, you should remember this. It is never too late to quit smoking. Basically, within 20 minutes, your body begins to see the physiological benefit of quitting smoking. Within half a day, your carbon monoxide levels drop to normal. Okay, couple weeks, you're getting actual improvement in both your heart and your lungs. Couple months, you stop coughing all the time. You get your breath. Your cilia begin to work completely normally again. A year after quitting, your coronary heart disease risk is half of that of a smoker. 5 years after, you have multiple risks of cancer that are cut in half. 10 years after, again, the risk of dying from lung cancer cut in half of that of a smoker, also seeing decreases in other cancers. 15 years after quitting, your risk of heart disease is equivalent to a non-smoker. The good thing is that your lungs will repair themselves, but you have to quit smoking. So when you hear somebody tell you that it's just too late for them, it's not too late. Every minute that you're not smoking is a positive direction.